Hi, would you give us your name, please?
My name is Jackie Simmons.
And Jackie, would you share your healthcare story?
Well, I have a different perspective. I'm a nurse, and so I'm involved in the healthcare system as a provider. And I just don't feel that I'm doing what I've been trained to do. I was trained to promote health and wellness. And in this current system that functions totally from an illness model, I'm not doing what I'm supposed to be doing. I'm not teaching prevention. I'm not promoting any wellness. I'm just really doing whatever insurance companies dictate us to do. Like if you have patients who are really sick and they can't get treatment at this particular hospital, you have to send them somewhere despite the fact that they're so sick. Like for instance, I had a lady one night with a blood count of 6 and the normal is like 12, and she needed to be transfused, and I asked the doctor and he told me no. Send her out, let her go to Cook County. She can get the transfusion and the surgery that she needs. I work in stem cell transplant. There's so many people that are seeking transplants, liver transplants, and they're told they can't have them. They have to die. Nobody knows what you feel like. You're supposed to go home and feel good about what you do, and I don't anymore. I feel sad about what I'm doing.
Wow, and if you had opportunity to talk to the administration and Congress, what would you want it to be?
That if we continue, I can't get people to understand, the current healthcare system is gasping. The wheels are off the bus. It's just going to go nowhere. I want to see a public plan so that everybody has health care, because what's happened is you've developed two levels of health care, those that have and those that don't. And you really don't want to be where those that don't have it, because it's not a good place to be.
Wow, okay, and as a nurse, you've seen patients turned away, forced to go other, and what type of health care do you see those patients getting when they go to other facilities?
Sometimes we don't follow up, sometimes they die. I don't think anybody realizes how many hospitals were closed in Louisiana after Katrina. And people who went down to Louisiana said children were literally dying. The major hospitals were closed down and they never reopened. There's not any care. And what you see too, people are waiting longer because they don't have care and they're so much sicker. And when they come into us, they're almost at death's door. And then when they die, the family is puzzled. What happened? What could have been done? And we need health care. Everybody needs it. Because like I said, it's two levels, the haves and the have-nots. That's what it's evolving into.
Now, you mentioned earlier that as a nurse, education and well care is really what you wanted to do. What does that actually look like when it's in a perfect world?
Well, what it looks like is you're going to teach patients no matter what continuum they're on. Let's say you have somebody with high blood pressure. You want to keep their blood pressure as normal as possible, so you want to regulate their diet, have exercise, and teach them the importance of avoiding stress and incorporating all these things. We're not doing that. When you give these patients a cessation smoking or their lipid profile, they throw it to the side and go on home. When you watch them, their trays, all the green vegetables are sent back to the kitchen. They order in hamburgers and this type of thing. We're missing the point. There's no teaching education.
Okay, thank you very much for sharing your healthcare story.
Thank you.